One confirmed, 4 negative, which brings the numbers now to 13 of positives. This particular one is linked again to patient 1. Remember, I replaced 0 with 1 last evening. So this is the first patient from the Blue Bay area. Another positive test linked to patient 1. It also justifies for us why we took the decision to quarantine that would be 7-8 mile area, because so far the numbers that are linked, if they were moving about, it would certainly create greater spread depending on where they would have gone and who they came in contact with. Tomorrow we are going to be doing an additional 11, but we have slated 11 tests to be done between today into tomorrow, and we'll give you information on that as it unfolds. In terms of the overall statistics, or status, 413 persons have come into the island from a country of interest since January 31st. There are now 12 confirmed cases of COVID-19, 13 confirmed cases, of COVID-19, given that we have just added 1. 27 persons are in quarantine in a government facility, 52 are in home quarantine, limiting persons entering the particular institution to within that 20-person limit as part of managing the numbers. Service related to oil refinery distribution, loading and transportation, and loading and unloading of ships would continue as usual, and of course that is critical to ensuring that the country has its usual supplies, so it's really cargo related. In terms of closures, bars, nightclubs and places of amusement are to be closed for the 7-day period. Places of amusement include cinema, dance hall, club, open air dance venue, amusement, arcade, skating rink, to the extent that we have those roller discos. Those are all contained in the enforcement order. Public transportation services including JUTC and Montego Bay Metro are limited to seated passengers only. So seated passengers only. Taxis are required to transport 1 passenger less than they are licensed to transport. So in one case I think it's 5, so they'll be allowed 4. Arrangements have been put in place for medical officers to be on call for medical direction in the community and support to social services under the leadership of the Ministry of Labour and Social Security, who are distributing care packages for families in the zone. Now I want to just pause here to say that we have heard yesterday that some persons were suggesting that they were not getting these packages. We have indicated that to the team on the ground. We reiterate again that for persons who feel deprived as it relates to food items or basic essential items, that they report that to the personnel who are placed or based at the locations, and we will do the necessary follow-up. Restrictions on persons coming into the island who are coming from a country where the virus is spreading internally. That was part of the announcement yesterday. We will place on our website those countries that are affected. I believe it's somewhere over 80 countries currently. It changes fairly frequently, but we will place those on our website, and so persons can be informed as to which countries these are. The quarantine arrangements applies to both locals, but also persons anyone coming from those countries. And the requirement would be for home quarantine for those who are coming back into the island. And in the case of hotels, we want to just emphasize that there is a restriction around quarantining, but the guidelines for hotel quarantining are as follows. And I will just cite the sort of significant features just to be clear. So guests are allowed to move in and around the hotel. So it is not, and let me repeat, it is not a restriction to the hotel room. It's more a restriction to the hotel property. Persons can go to the pool, can go to the beach. What we are emphasizing, however, is that we, as best as possible, and the hotels have to do this, maintain the social distancing that we have been promoting because of to minimize the risks of spread. To the extent that guests do not have symptoms, they have symptoms, they have to be confined to the room, and there's a protocol in relation to notifying the health authorities. To the extent that they don't, then they can move around. The nurses and the challenges that they face, frontline workers, tomorrow, this is in regards to transportation to and from work. And the discriminatory practices that some taxi operators have been engaged in refusing to take them back or forth. We have condemned that action, and I've had discussions with the Minister of Transport, and I know he has taken up some of the concerns with the different associations. I've had dialogue with the nurses and the President in particular, and we're going to be looking to see what arrangements can be made to give some critical support to our frontline staff. It may not be taking you from work to home, but certainly taking you to a central point. A number of hospitals currently do that. We're going to be reviewing it to see what else can be done. In addition to that, tomorrow I am going to hand over, assuming we can get the logistics right, if not tomorrow, the next day, 5 new buses that have been purchased for the nurses to provide critical transportation to those central points. And I know 5 is not enough for the entire country, but it's certainly a good start. We will also be talking to the management of the hospitals to see what other arrangements can be made.
So while it is that we have said a lot more about the index case, because as you realize, based on her itinerary, she did a bit of movement, especially around her community, and so there were a lot of contacts. But our public health teams have been on the ground in all the parishes where we have persons, and we have been sort of finding the contacts. We have been putting them in self-quarantine. For those persons who have developed symptoms, we have been isolating them. So far, we have tested contacts for the other cases because there were a few of them that have been symptomatic, and those were included in our negative results. So right now, we have two imported cases that have contacts here that would have become symptomatic and would have tested positive. And those are all isolated and in isolation facilities. But a lot of work has been going on in all the parishes to find these persons and to bring them in. And as we're here, I just want to make an appeal to the public, because some of these persons have been resistant in coming into facility. And so we just want to encourage persons that it is in their interest and in the interest of their own families that we bring them in to be isolated so that they can be tested and treated until they get better.
But the general principle for me is that the extent of the risk determines the extent of the response. So we have 13 cases. We have 1 community quarantined. We have 3 or 4 other communities where contact tracing is taking place. We have announced a series of measures for self-quarantining, for closing of businesses or restrictions. To us, that is a measured response to an assessment of the risk currently. But that could change tomorrow or next week. And that's the principle on which we are operating. So to your question as to the supermarket, we appreciate the need for you to buy your food. And let's be clear, some Jamaicans only have enough disposable income to buy their food every day because they work and live, as we call it, from hand to mouth. And to shut down food establishments, whether it's a corner shop or the supermarket, would be tantamount to saying to Jamaicans, you may not have much to eat for the next 7 days. That's impractical. And that will raise several other challenges which we can't solve. So the allowance of opening while guiding the population and the gathering is the best option given the context that we have. And so it means then that if you're going to the supermarket, try not to congregate, go buy your stuff, take it home, and ensure that your family is appropriately fed.
Remember that we saw our confirmed our first imported case on the 10th of March. This is a new virus, and we would only be looking to persons coming into the country with the virus. So our detection is to really try to pick up as early as possible these cases. So we would not have any cause to believe that we have any bodies that are presently in the morgue that may have been deaths due to COVID-19. We have absolutely no reason to believe that.
Need for the public to understand, and therefore we have to provide them with more information, more resources, so that they can appreciate why it is that they should not undertake certain discriminatory actions in dealing with persons who they suspect, and these are not persons who are confirmed, people who they suspect may have contracted COVID-19. So I really wanted to take this opportunity to launch out into that field and begin the conversation around preventing stigma and discrimination from taking root and from expanding.
We've heard of cases of persons being threatened and so on, and we obviously will use the law if we must, but we prefer to ensure that all understands and appreciate the need to be careful and to exercise sensitivities to the realities of the challenges that we face and work to overcome those. There are some other areas like the mental health of the population and the need for us to manage that carefully. We're going to be giving out some additional support, but that we'll discuss that later on.